It's a really exciting field because there's so much we don't know about the lymphatics. So for me, it was the most exciting field. Unbelievable. There are several ways to train. I never trained in lymphatic surgery, I just started doing it. But I was already very experienced as a microsurgeon. And it's just, the technique is the same, it's just the vessels are smaller. You can't do it with regular micro instruments. You need smaller instruments, you need smaller sutures. You can practice on synthetic small vessels if you're not comfortable doing smaller vessels. There are courses you can do, or ideally, if you do a micro fellowship, many fellowships offer lymphatic surgery, so you get experience. And it's not just a technical aspect of doing the surgery, it's choosing the correct operation for the correct patient. If you're starting a program from scratch, it's important to have knowledge, first of all. So you need to know about lymphatic surgery, you need to know what it can do, and you need to have some idea of which patients are appropriate to operate on. But you can't do it by yourself. You need the help of other specialties. Radiology, do MRIs, nuclear medicine for lymphangioscintigram. You need ICG so you can stain the lymphatics and find them. Ideally, you need a relationship with a therapist because preoperative therapy is very important and postoperative therapy is very important. When I started off doing it, I got a lot of resistance from the therapists because they thought that I was going to steal their patients. So it's important to talk to the therapist, give them talks, give them lectures to show what you can do and why they are important. When I did that, I found that most of my patients came from the therapist. So that was a big change. As long as you explain to everybody what you're doing and they understand, then they will work with you. And you need equipment. When I started doing it, I didn't have super micro equipment. I had an old Zeiss microscope. We didn't have ICG. So we used to make blind incision and inject with isosulfan blue to try and find the lymphatics. But then when ICG came along, that made a big change. And then instruments got better, the sutures got better, and then scopes got better. When I got my Mitaka, it was a game changer because all of a sudden, instead of guessing what I was looking at, I could see what I was looking at. And so that's really important to be able to see what you're doing. You know, when I started doing it first, I didn't broadcast what I was doing to oncology surgeons until I was happy that it was working. But then once I knew that it was working, then again I talked to my oncology colleagues, I gave them lectures and showed them what we were doing, and then they started sending me patients. And then the other thing is my patients helped recruit new patients, because if I had a patient come in, I'd say, would you be willing to talk to another patient? I would give them the other patient the numbers, and patients talk to each other. So that's how gradually we started it.